Nicole. Next to me is Maya. That's Juliet, and that's Sam. And the four of us are for health. This is my aunt. She's a 45-year-old woman who lives in San Francisco with her husband, her mom, and her son. She provides medical care to her son, who has an iron deficiency, so every single day she needs to make sure that she's giving him his iron pills and all his supplements at the right time. Also, she provides medical care to my grandma, who, like many other elderly people, takes multiple medications every single day. Currently, my aunt uses a handheld weekly pill planner to manage all of her pills. Also, she has these slips of paper up on her wall where she writes every single medication she takes and how much she takes and how much of each medication to give her at each time. But writing on paper is not the most efficient way and can be easily confusing. On top of all of this, she is a medication user herself. Every single morning, she wakes up and she takes a couple different supplements, such as calcium and vitamin B12. But managing all three of these people's medications can be confusing for her. Just like her, 90% of American adults take at least one prescription medication or more. Furthermore, according to Guardian Life Insurance, there are 100 million caregivers in the US. This includes parents who provide care for their kids, people providing care for their own parents, like elderly people, and then also professional caregivers providing care for their patients. However, just like my aunt, 70% of people say that it is difficult and stressful to manage their medications, either for themselves or for their patients.
And this is exactly why we created 4Health. 4Health conveniently lets their users conveniently scan prescriptions, check for drug interactions, schedule medication, and receive reminders. And here's our demo. Here the user can log in and sign up and view their profile, as well as their medicine cabinet that could have either their medications or their supplements. Here the user can scan their medication and see possible side effects and possible healthier alternatives if it's a supplement and not a prescribed medicine. Here the user can look at their medication schedule and calendar, and on the right-hand side is specifically for our caregivers who not just take medication themselves, but also care for other people and need a patient portal just for them.
Our customer persona consists of middle-aged adults, middle-class individuals, those that provide care whether to a family member or friend, and those that take medication themselves. For our total addressable market, the digital health market is valued at over $170,250 million. Research through Statista, this market includes all forms of fitness as well as nutrition apps. And this number is expected to grow by 30% within the next 2 years. For a serviceable addressable market, we went through countless assumptions to determine our target market of close to 2.5 million people. These assumptions include those that take medication, caregivers that take medication, individuals that manage their medication with technology, as well as caregivers that manage their medications with technology. Our market share, our goal is to reach over 10,000 people within our first year. We found this through similar health tech startups being their median, as well as a conversion rate of 3%. And with our price at $9.99 per subscription, we're looking to make $38,481 within our first year, leaving us with a market share at over 0.013%. For our competitors, our three main competitors are AccessCare, MediSafe, and MyMeds. AccessCare being an indirect competitor of ours, they provide scheduling for caregivers, although they do not provide medication information as well as accessibility, as their website is very hard to navigate. For MediSafe, being our first direct competitor, they provide scheduling as well as a usable interface. However, they lack medication information only through user input. For our second direct competitor, MyMeds, they provide accurate scheduling and tracking as well as medication information. However, they lack accessibility as their app is prone to common errors as well as bugs.
So one of the ways that we will be using to promote our app is through Instagram. Since we already have an account, it'll be a lot easier to use it and attract more people, considering that we already have a following and a couple of views and posts. Another way will be YouTube. We are just starting to use YouTube, and we have tested the waters a little bit by posting some shorts and a video. And both of these ways will lead to our website, where the users can sign up to be our pilots and kind of test everything for us before we go through the plan into making our app. So before our app, we will be manually testing by texting and emailing our pilots.
This leads us to the beginning of our MVP. For the first 2 weeks, we're going to be focusing on our promotional tactics to gain more traction on our social media through ads, as Nicole said. And then once people have have reached our social media pages, they will be directed to our website, where there will be a link for them to fill out a survey if they're interested in being a pilot for 4Health and testing out what 4Health will be like. And in the survey, we're going to be collecting contact information like emails and phone numbers so that we can contact them in the future. Once we have received this information, we are going to move on to our actual testing, week 3 and week 4, where we will be texting our pilots notification reminders through the text messaging app, and also we have the scanning feature in 4Health, which will be an AI feature where you can scan your prescriptions and get information on it. But for the testing, we're going to be getting the information by ourselves and testing them. And also we're going to be giving them a calendar for the week or the 2 weeks or the month that has all the times they need to take their medication or give medication and how much of it also. For the first week, week 3, we're only going to be messaging families and friends so that we can get the hang of using this texting app and know how we're going to do it. And then in week 4, we're going to open it up to people who responded to our survey saying they were interested in it, and we're going to start texting them all these things too. At the end of week 4, we're going to be sending all of our pilots a survey, and now we're going to be asking about their experience and what they liked, what they didn't like, and what they would change, which would lead us to week 5, where we will spend that week improving our MVP and making it better and more suited to our customers. This will lead to week 6 and week 7, which will be our second round of testing. We're still going to be texting them through the phone number and giving them information and all the scheduling, and we're going to be making all the changes that they said they would like to see, and hopefully this will be a better MVP. And then at the end of week 7, we're going to be sending them another survey. This time we're going to ask them whether or not they would pay to use a service like 4Health to get notification reminders and information about their prescriptions. And if they say yes, then we're going to figure out what they would pay for and what they would not pay for, and move on into week 8 onwards, where we're going to be continuing our manual MVP, texting them through our phone number, and this time generating revenue and making any changes as we see fit.
We sent out multiple different surveys, including to caregivers and to people who take medications daily. And we conducted multiple interviews with caregivers and people who take medications daily. Through that, the majority of people who take medications daily were willing to pay $4.99 for a subscription a month for our app. And caregivers were willing to pay $9.99 for a subscription. Also, the credit card processing fee, which is our only COGS, would be 17 cents taken away from us for every unit bought of a personal subscription. And for caregivers, 35 cents taken away from us. That would make our gross margin about 96.5%, which is very good for us. Also, we would be asking for $100 for Instagram since we already have our platform built up, and $50 for YouTube for our ads. We will also be asking for $20 a month for 3 months for Text Free, which is a website that will help us create a phone number so we can text customers and test out our MVP. We'll be also asking for $34 a month for Jotform, which is a website that will help us create forms, make them look more professional, and collect emails on our website. At 4Health, we value customer security and safety. That's why we will be paying $50 for GoDaddy.com, which is a website that will help us create a domain name and help us make sure our customers are safe and secured on our website.
All of this adds up to roughly $375, which is what we're asking from you today. And the 4 of us are 4Health.
4Health.
In terms of what makes you guys different than the competitors, one suggestion, in 3 months when you're presenting again, a grid would be really a lot more easy for me to process than just words. But 2, what is the revenue model of your competitors? Are they charging subscriptions? Are they monetizing through ads? How does?
For our competitors, Access Care, they're just charging subscription fees,
Okay.
as well as MediSafe and MyMeds. So they do offer all subscriptions. The prices do vary. We are a lot less than our competitors, so that is one of our advantages. But in terms of what they're generating for revenue, they might be using or selling their data.
Is there any concern about, I don't even know if it's a thing, is HIPAA relevant for people who voluntarily tell you what their medications are?
Yeah, so we would have a HIPAA compliance, so we would have all their information secured and we would not be sharing that. Just in terms of data throughout the app and what they're sent to.
Can you explain a little bit more? So two of the competitors did not have medication information.
Correct.
And the third competitor you said, what's that?
The error prone.
Yeah. And then the third one, there was like a buggy app. Spoiler alert, if you build a software, it's gonna be buggy. So, you know, when you get into that world of development, it's really nothing but bugs for a long time. So maybe just explain a little bit about the medication information, like just expand on like what that means. They're lacking medication information, you have it, so, but you're requiring your users to input their own medication information. And those other apps, they don't allow that, it's not part of the feature list, so I'm just.
So for 4Health, what our UVP is, it's a scanning feature. So that's automatically gonna integrate their medication information. And we'll be passing that out to them, providing them like details on side effects, symptoms, just a short summary of the medication of what they're taking. Our competitors do not do that. I think one of our competitors, they do it through user input, so they would have to personally input their medication.
Medication information is side effects, and I got you, not what medication. So they all do that, so you're just making it all in one place, so they don't have to Google what are the side effects, or if they forgot, or they can't keep track of them. Okay.
That also adds like to our scanning feature, like it's the convenience that is really like a big deal for everybody, because of course it saves time.
Yeah.
That's a big thing for.
Do you guys have any, did you get any cost estimates or talk to any computer science software developers on what it would take to build what you want to build?
We were thinking of having it being like AI powered, like getting the information from AI, but that's not always like reliable. So we were still looking into that. Like we were thinking about like Fiverr or something, like finding a professional to help us with that, but we're still like working on that.
If I can add, that will be all part of our startup costs. We've done a little bit of research, but we do need to do more research.
I actually don't have many specific comments. I just wanted to, you could tell you guys prepared really well. You presented very well. The presentation was very clear. You've practiced and it shows. So I just wanted to say really good job.
Yeah.
Thank you.
Agreed.
I agree with all that. I think the MVP process that you guys followed was really strong. The benefits were really clear. I really like the fact that you brought your fans in to connect the benefits with the actions. It really brought to life the concept that you were teaching. I thought that was great. The big question I have, building on what Chris said, is the how. How are you going to link all this? How are you going to get this to work across multiple smartphone platforms? That's a big unknown, and I think that it would really help you if you understood how big that and how steep that climb is going to be, because I think that it's going to help you on cost, timing. There's just a whole host of issues as to how are going to roll out of that, and I think that's going to be really key as you move this up. Just by quote.
That's why for like the beginning of our MVP, we're trying to start off small, like only like have a couple people pilot, and then we can figure out like whether it all works through texting, like giving them reminders through texting works and information through texting, and then like build off of that and see what we need to change.
Okay. That's smart.
One thing right away that made me, skeptical about what I was gonna see after was the 100 million caregivers in the US. Is this, that's like a third of every living person, and 70% of all adults. Can you explain on that? And the 90% of people are on medication. Does that include like I take an Advil once a week, or that seems very, very high?
For the 100 million caregivers, like that's not just like people who like it's their job to caregive. It's like parents who like have kids that they need to like provide medical care to, and then like for a lot of
Oh, so I'm a caregiver and included in that with, just cause I have kids.
Like if you provide medical care to them, like
100 million.
Like an average.
It's one out of every 3 people. Yeah.
I know, but how many
are-
have like multiple parents, that probably counts as 3, you know, one person that has taken care of like 2 or 3.
You are considered a medication user if you're taking over the counter, just Advil or
Okay.
whatnot.
This is, okay,
It's also like vitamin supplements, that stuff too.
okay.
I think it's a great app that you're thinking about. I have a sister-in-law who has to manage medicine for her mom. And there's 15, 20 different medications on it. If she's not on it, her mom's gonna miss it if she's not there. And if there's something that would help her, so if she's not there, I think this is wonderful. So it's a matter of figuring out how to do it, or the user to put in that, you know, to change medications. I like the idea.
thank you.
The money, can you remind me what the ask is again? Yeah, I mean, I think you guys have thought through this so well, like, yeah, 375?
Good,
Yep, 375.
Got it, thank you, good job.